Good evening, dear friends. You're most welcome
Good
to this
evening.
International Journal of Homeopathy webinar, which is a series of webinars. And this is just before one more important milestone in IJH, which would be on 6th November to commemorate Dr. Vishpala's sudden demise. Before that, today we have a beautiful seminar with a fantastic topic, and it would be dealt with by none other than Dr. Shahala Nadaf from Belgavi. I think it should be spelled like that.
Belgavi. Yes.
So the names are changed. Okay. Now, in fact, the topic today is about temperaments. And it is such a common word used even colloquially that he has a bad temper, he lost his temper. So what is that? The temperament, is it useful for homeopathic prescription? Should we really need to assess the temperament of an individual? Is it different from constitution or diathesis? And who coined this term as temperament in our homeopathic parlance? All these things we would learn from Dr. Shahala, who has done her post-graduation and who has done a graduation as well, and who worked as a PG faculty in uh, college in fact Gujarat. That is something like wonderful. When I was going through her profile, she was working in Gujarat. This is something
Yes.
peculiar. I never expected a Karnataka person, a lady, especially going to Gujarat and teaching PG people there. And she also has done her master's in psychological counseling as well, which is very important. We all need it actually. I was undergoing a little depressions. Probably, had I known this, I would have consulted Dr. Shahala. Anyway, better late than never. I can consult her once again. And she also has done a post graduation, fellowship in dermatology. She deals with a lot of dermatological cases as well. She has a tremendous experience of more than 20 years of clinical practice, and she is a teacher in many colleges. She's really required to be a teacher everywhere, and she has a prolific presentation everywhere. I heard her several times. It's my good fortune, and it is really my privilege today, I should tell you, to introduce Dr. Shahala Nadaf, our associate editor of International Journal of Homeopathy. And she has been with Dr. Vishpala for a long time, and she has been with NJH, erstwhile NJH. That is, of course, transformed into the old wine in new bottle, so IJH. So now I request Dr. Shahala to take over and present her presentation on temperaments and their importance in homeopathy. Dr. Shahala, please.
Thank you so much, sir. A very good evening to all of you. Like rightly, sir, without wasting much time, temperament is definitely a very versatile, a very engaging topic. And I'm sure by the end of the presentation, at some point of time, we are going to analyze ourselves, especially of what temperament is a topic as such, because when we have read it in our undergraduate and postgraduate, we have studied temperaments with Herbert Roberts, and he has very clearly explained to us four types of temperament. But today, I would like to add one more temperament of nervous temperament, and this particular temperament extra one we have tried to add because the modern stalwarts, especially Dr. Parina Zumranwala, who is a pioneer in India, to talk on temperaments and release a book, and now she has a temperance also. Basically, this topic is today's talk is a very special one for me. First of all, because I am presenting it for the first time ever as an IGH member. I'm a erstwhile NGH associate, what we call editor, but presently first time ever I'm presenting this case. It is more special also because we have this lovely audience right now of 60 people, and Dr. Praveen sir being my mentor at the moment. And I welcome you all for this presentation. I hope you enjoy, and we'll go set it right, sir. Should I start, sir?
Yes, please.
Yeah.
Yes, please.
Yeah, dedicated to my teacher, mentor, and philosopher.
Now, we are not seeing the screen.
Okay,
Please share it.
I'll just share it once more, sir.
Yeah.
Sharing is not turned on, it's showing. Please, can anybody turn it on?
Yeah,
Yeah.
Shahala, I will do it. Just a minute.
Yeah.
Yes, Shahala, you can
It's
do it
turned.
now.
Okay.
Now you can do it.
Yeah. Is it visible, ma'am?
No,
Now?
not yet. Yeah, your screen. Now, yeah, you can now maximize. Right. Now go for yes.
Is it visible, sir? Okay.
Yeah.
Yeah. So basically, this presentation dedicated with all the solemnness to my dear teacher and philosopher and guide, Dr. Vishwala Parthasarthi. Also, ode to the great teacher, Dr. Parina Zumranwala, for her extensive work on temperaments, because she has brought a very important perspective in the facet of homeopathic totality, especially to all of us homeopaths who do a holistic practice. So before I embark on the topic, I would just like to talk about, in short, about what is constitution and how it's different from diathesis and personality. So basically, the term constitution, I will not go into more details, is from the Latin word constitute, that is to set up or to appoint or to make up. So the constitution, as we homeopaths know, is the natural condition of the body or the mind and disposition, that is the inherent nature of every human being. So when we see at a glance, the constitution and temperament look like very close relatives, I mean, very close terms. But there is a vast difference in understanding this particular thing. So first, let us understand what is constitution. Constitution comprises basically of mental generals, and the physical generals. Now, in mental generals, temperament is actually the mental generals, and the second part is personality. Again, here there's a lot of what you call confusion between temperament and personality. We need to understand that temperament is the mental generals, which is in what you call inbuilt in any human being for that matter, whereas personality is that what we develop as a human being. For example, we can say temperament basically is what you are when you are with yourself. For example, Mr. X in the bathroom is the temperament. Mr. X in the boardroom is the personality. Personality, as we grow up with the environment, with our what you call challenges that we face in life, the type of lifestyle we have keeps on changing. As a child, I may have had a different personality, but when I become a doctor, when I'm talking to you as a teacher or a presenter, I have a different personality. So these basic things we need to segregate whenever we see a patient, because most of the times the patient walks into a consultation with what we call as personality. Temperament is something that I have to dig in as a homeopath and understand what it is. And physical generals, I'll not go into details. We all know about it. The general craving, aversion, etc. comes from physical generals. And therefore, the mental generals, which constitute of temperament and personality, is called as a constitution, along with physical generals. So what is temperament basically? So temperament is nothing but a specific, intense, passionate nature. It is a psychological and biological organization peculiar to each and every individual. Each individual, even if it is a twin brother and sister or brothers, or siblings, they are going to have a different what we call temperament in varying degrees maybe, but yes. So like I already told you, a temperament is what it takes to form according to a genetic material. The temperament is a real me. And how is temperament different from personality? Is temperament is a dress one puts on oneself. It's a facade that we wear, the attire, the clothes we wear, and how we groom ourselves, how we talk, eat, sit, etc. So personality is what we see, that is the outer shell of the coconut. The person in the bathroom, like I mentioned you, is a real X and not the one portrayed in the boardroom. We are all born with temperament traits. That is our raw material, our own base, but personality is something which can be changed, developed, or enhanced. So this is the basic difference between temperament and personality. I hope it is clear with everybody. So one of the basic tenet of homeopathy basically is individualization, as we know. So once we understand how to what you call read a temperament in a patient, we can treat the patient more holistically, more in an individualized fashion. Because I we just mentioned that basically temperament is individual to every human being. Okay, we are born with a certain core. Okay, that core, that temperament cannot be changed, and that is the basis of homeopathic prescription. Yes, this temperament can alter a bit when you're sick, but the core remains the same. Uh, as we discuss one of the cases, we'll come to know about it. So I will not go into the details of the aphorisms. So basically aphorism 211, 12, 13. These three aphorisms convey that homeopathic case should include the physical generals, the disposition, the causation, and the mental generals, which is nothing but the temperaments. And Hahnemann highlights the importance of considering the temperament of the patient to arrive at a prescription. So study of temperaments can throw a light on the following. Like it tells us what are we made of, who we really are, why do we react as we do, what are our strengths and weaknesses. Now I'm using the term we, but we are also talking in terms of the patients. Okay, a very important aspect why we need to understand temperaments. So basically, according to the general psychological terminology, there are only 4 types of temperament: sanguine, choleric, melancholic, and phlegmatic, which have been described in detail. Even Herbert Robert has clearly mentioned about these 4 temperaments. But in a Materia Medica, when you go through a Materia Medica, we have a very fifth important temperament, which is a nervous. So one point I would like to make it clear at the onset is that there are many combination of types. It's not that a person is only sanguine, a person will only have a choleric. There can be a mixture or a combination of 2 or 3 types of temperaments. And there is our art of how we understand our remedy and prescribe. Because we get many remedies with predominantly one temperament, but there can be what we call uh, other inputs to it also. Like for example, it could be a person can be sanguine with choleric, a person can be with choleric with melancholic. Just like how we in miasms, we cannot say we have purely one miasm in understanding the patient as a whole. We also know that miasms also come as a mixed miasm whenever we take up a case. For example, it could be sauropsychotic, saurosyphilitic. Similarly, temperament also has its own presentation. There could be a combination of these types, usually with one basic type which is predominant. For example, if it's a case of belladonna, a belladonna could be a remedy which is highly sanguine, as we know, but it can also have a choleric aspect to it also, in terms of the mental makeup as well as the physical makeup. So this point we need to understand in the initial stage itself. So just let me tell you a few key points of each temperament so that we can understand and then we can work upon our cases better. So a sanguine temperament, I think all of us know about this particular temperament very well. Basically, if the picture itself depicts a typical sanguine temperament, a sanguine person is very extrovert, a talker, a optimist. Please note down these key points, what I'm talking at the moment, because that will help us to again enter the sanguine personality in more detail. And I hope by the end of the presentation, at least few points of each temperament we come to know. which we already know, but subconsciously we use it. But now, maybe after this particular topic, we will be able to assess it more properly. So basically, understand, see the picture. It itself depicts a sanguine person is highly extrovert, a great talker, a very optimistic person. So you can say the sanguine person is a people's person, very vivacious. They always manage to have fun. They do not get tied down to relationships or to any one activity. They live for the day. Today is the day, I will live it. You will never find them worrying about the future, nor they are bothered about the baggage of the past. They live for today and for this moment. They are highly exuberant people, and even their anger is very effervescent, in the sense they get anger very easily, and it comes down also very easily. And they do not have a grudge. That is a very important aspect of sanguine temperament, which is quite different from the other temperaments. So these particular people live in the moment. They are not bothered about the past. So naturally, they don't hold a grudge of anybody, even if they've had a bad moments with someone. But every temperament has its strengths and weaknesses. So to make it more palatable, I'll just talk about weaknesses and strengths of each temperament, so that in the end, we can coordinate it properly. So though sanguine temperament, when you look in the first slide, it shows that it's a very vivacious, very positive personality. But a sanguine temperament has its own, what you call, drawbacks too, or weaknesses, what we call, and which we see in many of our remedies. So basically, you see a sanguine person is so, what you call, in his own joyful mood all the time. They do not want to be in a state of displeasure at all. They're always seeking fun, party, etc. So basically, these people, if you see the weakness point of time, they're a bit disorganized. They do not have any follow-up, good intentions, no action. They do not accept blame. That is very important. They talk anything they want until the party is over. They will talk it, and afterwards, if something goes wrong, they will not accept the blame. They talk too much. They are very bad listeners. They're prone to exaggerate anything, and that is why they're people's person. They are the joy, or they are the heroes of any party, hero or heroine of any party or any gathering. They repeat stories. They brag a lot about themselves. They're self-centered, sometimes insensitive to others' needs, not because they want to put down the other person, because the personality or the temperament itself is so gross that they need to be in picture always. They need to be in the forefront. So at times it can result into insensitivity to people. And they appear a little shallow, because the only point is they would not study anything deeply, any point. They would just like to talk about it and be in the limelight. So they can be fickle friends, because you cannot expect them to have a consistency. They may immediately change, make a joke of things which may be a little more sensitive to you. Okay, so the patients which come to us, when they narrate the stories, or when we see the live space, we find this particular thing. They say, I'm so vivacious, I go to every party that I'm invited, but I don't know why this particular person has some grudge against me. So they can be what you call very fickle, and sometimes very immature answers. They struggle to grow up. They want to hog the limelight. They have very impulsive decisions. They can just say, for example, I can tell you one particular incident of a lady recently. She had got ready to go and play garba at a particular event near my clinic, and she came for the follow-up. And then she got a call from a friend, and they said, tonight at 9:30 we are thinking of leaving to a resort which is close by to Belgaum. And this lady, in the same attire, she came for the follow-up, and then same attire, the same gusto, she went to the next party which was there in the resort. So that is how these people are. They can be very impulsive, and they do not mind. For them, enjoyment is the main theme. Okay, they get bored easily because they want novelty every time, in talks, in parties, in meeting people. So they cannot sit and listen. They're very bad listeners, like I told you earlier. And so inclination to flirtation, jealousy, envy is quite common. Cheerfulness and inordinate love of pleasure. I mean, they just want any type of pleasure, and very quick pleasure for that matter. So these are the weaknesses of sanguine temperament. Now, if you see the strengths of sanguine temperament, because they are extrovert, they readily make very good acquaintances or friendships. They're very communicative, though they're loquacious. Okay, and many remedies may be coming to your mind right now. Yes, those remedies do come, and I'm sure lacasis must have popped in everybody's mind at the moment. They associate easily with strangers. That is a very good point about sanguine people. They are friendly in speech and behavior, and their main this thing is they can entertain people anywhere, anytime. Like I told you, they are the Jan of the any party or the life of a gathering. So, for a better understanding, for a prescription, rubric, I've tried to segregate the rubrics equally of sanguine temperament. So all these rubrics you find in, especially in complete materia medica, I could see that all these particular rubrics for sanguine temperament were present. I've tried to put down most of them into rubrics. So basically, when we look out for rubrics for sanguine temperament, they are excitement or emotional, loquacity, vivacious, cheerful, desire company for, theorizing, in the sense they keep on talking things which they do not have a knowledge of at times. Okay, just if they are in the picture and if somebody is listening to them, they will keep on talking about it. Okay, and they're quite forgetful because the sanguine temperaments are so burst full of life and things, and so many ideas crop up in their minds, and they're not in-depth people. So what they have said last night, they can forget today and brag about something else in a different way. Okay, and basically they are careless. There are thoughts flow of rush. So all these rubrics we find in a sanguine temperament, and these are there in our materia medica, as well as these are taken from complete materia medica. Sorry, complete repertory. So remedies like ferrum phosphate, for example, phosphorus, lacasis, and coffea, you can see all predominantly indicate the sanguine temperament. The ferrum met or ferrum phos personality is a strong personality. A phosphorus personality is a very loving personality, whether it's a child, an adult, or even an old person for that matter. They mingle with people so well, and they are the darlings of all their friends too, because of the type of rapport or the fun, the excitement, or how they light up everybody's lives, you know. So it's a very great thing to have a phosphorus person. Like Dr. Praveen sir was just mentioning that he was into some depression and he wanted to consult me. I wish he gets more phosphorus friend, and that will eliminate more than a counselor. And then we have lacasis also, you know, the loquacity, what is there, and the theorizing, which is there, the carelessness, and like I told you, the weakness of a sanguine temperament is they can be quite mean at times with people because they don't have patience. So that comes in lacasis. And coffea, you know, is an extremely oversensitive person in every way. Even if a coffea person is so sensitive to both grief and happiness. Like suppose even if the child or even adult for that matter has to go to a picnic tomorrow, a coffea person will not be able to sleep due to excitement. Okay, because tomorrow I'm going to do this, I'm going to do that, I'm going to make the picnic so fun. So these are few remedies which I just wanted to bring to your notice. We have many more, and I'm sure as we go through our materia medica, we will be able to identify the sanguine temperament from the rest of the temperaments. I hope I'm clear. I'm not going too fast.
One of the audience wrote that you please be slow, but
Right.
if you cannot because of your temperament, don't worry about it.
That's perfect, sir. Sir is already started having this thing. I told you that by the end of the presentation, we are going to introspect ourselves and our friends and family relatives at least. Of course, we do it for the patients in a different setting, but this is going to be a fun presentation, sir. Thank you. Fine, sir. So coming next, after the sanguine temperament, I would like to go to the next temperament, that is a choleric temperament. Okay. Now, like you can see the pic, they are the boss. The choleric people are the boss. They are extroverts like sanguine, but unlike sanguine, they are basically doers. They plan out, they manifest, and they get the work done. They're usually great leaders, and they're highly optimistic people. Okay. Like we have our PM also, which covers all these 3 points, you know, the extrovert, the doer, the optimistic. So they are great leaders, basically. And sanguine people are extroverts, you know, but they only do it for fun and pleasure, and it is self-centered. Till I enjoy, I'm there. The moment I get bored, I walk out of the place. I will not even take the responsibility what I have started, or I'll not end the responsibility and bring it to terms of what I've started. So persons with choleric temperament basically are very authoritative. They are very dominating, resourceful, and confident people. They are adventurous. They're very persuasive. You cannot tell. At this point, I remember whenever in the initial days of my presentation days in NGH, uh, this particular point of choleric temperament was very marked in Vishwala ma'am too. She was very persuasive. You don't give me any what you call excuses. You're going to present, even if you don't know computers. Shahala, you are a very what you call intelligent girl. You must do it. I mean, that is how these people, I know, they make their leaders, they get the work done, and they make you what you call very very capable of things what they would like to be done in their team. So basically, choleric people, they are adventurous, persuasive, very confident, and they're powerful people naturally because people trust them. Because you can say that a choleric person may be a strict person, a very dominating person, but in the end, the work will be done. So they're basically good decision makers. They are born leaders and they're innately aggressive too. Aggressive in a not necessarily in a bad way. Aggressive in the sense if the work has to be done, whether it's day or night, it does not matter. So their basic mantra would be nobody dies with hard work. Okay. So that is how these people are made. So they are very hardworking people and they make others also work very hard. So, like I told you, every temperament has its own weakness and strength. Now, weakness of choleric temperament, basically, they have a bit of superiority complex naturally because the people around them, because they are the leaders, they have become leader because they are more superior in many aspects, whether the skills, whether the art, or whatever functioning of that particular team. So they do have superiority complex at times, which can get a little more intimidating to the team members or to the subordinates or to the family members. They have explicit anger, very clear anger. They are deceitful, disguise, and hypocrisy because by hook or crook, the work has to be done. That is how. If I start a job, I will not wait and see how it is going to be done. At times, they can be very deceitful and they can be hypocritic at the point to a point where if the work has to be done, let me do it like this. Lack of sympathy also can be there. So you have a combination in leaders too, right? Leaders are there. You can have good leaders and you can have average and bad leaders. So a choleric temperament revolves around all these three vertical leaders. Maybe a good leader may not have so much of a deceit, disguise, and hypocrisy and a lack of sympathy, but a bad leader, he's a leader though, can have these things. So these are the basic weakness of choleric temperament, and we find it in multiple remedies in our Materia Medica. So what are strengths of the choleric people? These choleric people are basically very successful in their professional work. Okay. And they are very active temperament. They feel a continuous inclination to activity and occupation. They want to update themselves with newer techniques, newer things in their professional or their personal life. And one thing is they cannot be quiet. They cannot be without work. And the work has to be very quick and diligent. And in every aspect, in every enterprises or in every work of theirs, they are very persevering. If I start a job, I have to complete it. And they're full of courage. That is our beautiful aspect of choleric temperament. They do not get scared of any obstacles. Without hesitation, you can place them in any post, especially difficult posts, It could be at the army level, it could be at the political level, it also could be in organizations like a principals and all these people work things which require a lot of decision making. These people can handle anything very interestingly. Once it's interested, they can do it very well. Okay, so difficult posts, choleric temperament have a great shining. In the speech, the choleric people are generally very brief and definite. They do not like useless repetitions because they mean work, they mean business, right? So they would not like to have anything which tries to elaborate any particular topic or just pull on like a sanguine. He may just blabber many things and gossip things, but not a choleric person. So this brevity, this positiveness, brevity is nothing but the firmness that a choleric person has, the positiveness, the in speech and appearance gives him a great deal of authority, and especially when engaged in educational work. Like I told you, most most of the people, most of the principals of any colleges, schools are basically people who are having the choleric temperament in predominantly, because they're the people who can lead the particular institution, especially educational work, to greater heights because of their temperament. So again, coming back to rubrics, see, all these rubrics I have taken from the complete Matri Medica. So whenever you have a rubric after anger and vexation, you can very safely steer yourself towards choleric temperament. They basically are very industrious. Industrious means once they start a work, they have to complete it. Okay. I recently had a homemaker. She was saying the rains in Belgaum have gone for such a long time, but I have to make papad, okay, for my entire family and send it to different places. So they're so industrious. She will start her job at 4 o'clock, and in the morning, that is 4 a.m. in the morning, and by evening 5 it should be over. And since it was raining, she saw to it that she put it inside the hall, and the task of sending that particular kgs of the papads, the appams, what you call, was done within a steer time of almost 1 week. Okay, so this is how these people, you can understand the personality. Not necessarily I have to have a principle to understand a choleric person. Even in a regular homemaker, you can find this particular quality. So this is called industriousness. She says, if I start a job and I know I have to give this particular parcel at this particular time, I will see, come what may, I will complete it. Whether it's raining or it's sunny, whether I have to wake up early in the morning at 4 a.m. and do it, I will do it. They're quite censorious or critical also at times, because they're perfectionists basically. They want the things to be done properly. They don't tolerate nonsense. So basically censorious. So this particular rubric is also there in a repertory. They're intolerant of contradiction. And especially they're intolerant of contradiction when they are right. Huh? That is one important aspect we need to. They are not like sanguine temperament. Sanguine temperament just cannot tolerate contradiction because they feel somebody's putting them down. They are very shallow. Whereas the contradiction intolerance which comes in a choleric personal temperament is entirely different. They are intolerant because they know they have studied the subject properly, and then they're putting it up. If somebody contradicts them, they would not like it. They would not tolerate it. So basically, they can be haughty. Okay, so that particular rubric we can take, like I told you, the weakness of choleric temperament. They can be haughty or proud, malicious. Okay, the things that they will want to, what you call, be hypocritic, in certain areas of their workplace. So they can be malicious, they can be destructive, impatient. All these rubrics are there. These all are rubrics, what I'm reading out. Capriciousness, dictatorial, quarrelsome, thoughts, ideas abundant, and clearness of mind is very, these are the rubrics that we can look out for in a choleric person. Remedies like lycopodium, most of the leaders, political leaders especially, are lycos, veratrum alb, nux vomica, bryonia. We know their temperament, especially nux vom, fastidiousness, and the irritability is 3rd degree higher. Bryonia also same way, and bryonia irritability reflects even in their physical aspect too. For example, if you read Kent's Matri Medica, he has talked about one particular example where the iron man, the person who irons the clothes, the dhobi, what you call, or the laundry person, he becomes very irritable due to the heat with which he's working in a small place with the iron. And the moment he starts getting heated up, he'll take out his clothes and come out and be in the open air. And that time, his mental irritability also is at a great height. He can get very irritated. So this one particular example, if you go through, you will come across in Kent's Matri Medica, especially in his lesser writing. So Lycopodium, Veratrum alb, are great leaders. Even we compare Veratrum alb to a leader like Hitler, for that matter, okay, who can be highly dictatorial, very destructive and malicious, for that matter. Then you have Nux vomica, then you have Bryonia. So these are predominantly having choleric temperament. I would like to remind you again, they can have a little combination of other temperaments too, but they are predominantly lyco. Like I just told you, we can have one miasm which is predominant at the moment, but other miasms are lurking in the background. So the keywords I would just So the third personality which I would like to talk is about melancholy. Do you all want a case right now? Because there's a case which is a combination of choleric and sanguine temperament. Should I take that, sir? Or
As per your wish, I think preferably you can take the
what the
case and
audience
then
would want,
conclude it.
because yeah, because it's going to be a little longer topic.
Yeah. Instead of
So
complete theory, like
okay, so
better
because we
you
are
go
finished,
through
I
the
think we
case.
can identify with the case. I'll go through the case. Just give me 2 minutes, sir. I'll just go
That's
through it,
good.
please.
Yeah.
It's a very interesting case which I've seen just few months back, in fact, in 23, but then I'm having the follow-up more regularly now. And this particular case is a typical pediatric case which came from a pediatrician. Fortunately, that pediatrician is very pro homeopathy, and with lot of understanding between us, we are dealing with this case. And the fortunate part is homeopathy has really given a very good result with this. So this is a case. I'm just giving a summary of this case. It's acute disseminated encephalomyelitis. This particular ADM condition is acute.
Lala, please go for full screen.
Okay, one second, sorry. Yeah, is it visible, sir?
Yeah.
Okay. So So this particular child came to me of 5 years of age with complaints of recurrent fever since 4 years of age. He's 5 now when he came to me. He was under treatment from last few months. He's only on homeopathic. But before that, he was under allopathic treatment for almost a year. And the fever used to range between something 103 to 104 degree Fahrenheit every time. And they just could not make out. They thought it is pyrexia of unknown origin too, because fever kept recurring since then, and he was frequently put on ibugesic without any relief. After 5 months, with some medicines, he did come down with some antibiotics and antivirals at that moment. But after 5 months, he had another attack of fever with chills, which was treated with anti-malarial drugs because of suspected malaria. He was readmitted again a few days later after the treatment with anti-malarial drugs. He was a bit okay for a few days, and then he was readmitted again a few days later with the same pediatrician. And that time, the symptoms, what the mother told me was, I'm telling you in short, there has been an elaborate history because I want to make it concise. The patient would get scared, shout aloud, and fall on the ground. So around that time when he was admitted, they also, he was going through this, he was presenting these particular symptoms. And so a lumbar puncture was revealed that he had encephalitis. He also had generalized convulsions once during the stay in the hospital. Only one time he had it, but he had a proper convulsion. He was treated and was free of fever till last month. Okay, till some August, he has come back with the recurrence of fever again. Now this time they have contacted me because two of the relatives are my patients. And during this course of time, he was also with the pediatrician. So he was administered immunoglobulins and with temporary relief. He did get relief for some time, but the fever was not subsiding. Paracetamol had no effect, whether it was crocin or ibugesic, no effect on him at all. And the typical chills and fever, what the mother narrated to me, was between 11 a.m. to 2 a.m. So during the fever, he was very dull. But once his temperature is normal, this is a point to be noted to all of us. He is very active and playful.
Dr. Shahala, 11
Yes.
a.m. to 2 p.m. or 2 a.m.?
Sorry, 2 p.m., sir. 11 a.m. to 2 p.m. I'm so sorry. Yeah.
No problem. No problem.
11 a.m. to 2 p.m. It's 2 p.m. I just wrote down the case today. Yeah, 11 a.m. to 2 p.m., sir. And he used to get this was the time modality he was presenting with. And during fever, he used to become dull. And once his temperature is normal, he was extremely active and playful. Okay. And he had no history of cough and cold along with fever. That is one thing. And since it's a summary, I'm telling you, I'm not telling the whole story. He's also on AKT and some Ayurvedic medicine, which I asked them to discontinue Ayurvedic medicine because AKT we cannot discontinue immediately. But in spite of all this medication, his fever does not come down. So his investigations, they showed me the previous investigations, what they had done in the year 23. His hemoglobin then was 6 gram percentage, lymphocytes 54, monocytes 31, ESR 6 mm. and lactate dehydrogenase, it was 255, which should be within 190. Now, lactate dehydrogenase is an enzyme which gets triggered off in higher quantity if there is an organ damage. So you can say there was a moderate organ damage, and the pediatrician suspected it was at the brain level. Okay. MRI suggested you ADM with primary complex. Okay, the Cox thing for which he was given AKT. But with all this treatment, he was not getting better. So they had come to me last in the month of January. And if you go through the past history, the birth weight was 6.5 pounds. The milestones were absolutely normal. The mother says, family history, nothing great. Grandfather had MI, father has hypertension, grandmother hypertension at an older age, and she is known case of hypothyroidism. So this is the basic history, what I could gather from the mother. Life space, I've just put it in points. I'm not elaborated it because, like I told you, I just typed it this afternoon. The patient stays with his parents and an elder sister. The patient, up not during the illness, okay, when he's in a normal state, he's very hyperactive. He'll jump from a height, is not scared to hurt himself, not at all cautious, loves to go out, meet people, can't sit in one place for a long time, and very obstinate or stubborn, you can say. He likes to watch comedy serial for hours together and laugh about it. The mother says, we wonder how can anybody watch so much of comedy, even if it is comedy. Okay. He loves to talk, makes friends very easily, and is not scared of even strangers. As a child, some children are inhibited, but this child is not that way. He can go and talk everybody. He says, the mother says, right from the watchman to the neighboring auntie and the guests who come in their house, this guy will just go and talk. So gets angry if someone takes his things or if things don't go according to his wish. If any contradiction is there, he does not tolerate it. Throws things when angry, cries very loudly, enacts everyone at home, especially because his grandfather is a tobacco chewer. He will try to enact and mimicry or act like his grandfather chewing tobacco. Likes to play in water and mud, a very messy child in general. Keen interest in dismantling his toys or electronic gadgets, and he spent hours knowing how the mechanism works. He has a absolutely very sharp memory. So if you in the clinic, what I was observing, the child was quite restless, kicking and touching things in the consultation room, was rolling on the floor. He seemed to be very active for the type of disease he had, because with this particular type of disease, a child tends to have a very a disposition which is very slow, or they respond very slowly. But this child was not that way. In spite of his disease, he was quite restless, kicking and touch. And of course, he had come to me when he had no fever. Probably they had given him a lot of paracetamol and brought to him the first day that they consulted. So this was my observation. Physical generals, basically the patient has a poor appetite from beginning, drinks 3 to 4 glasses of water per day. I could not make out whether it's scanty or motor, so I just put it down as verbatim as the mother explained to me. He has extreme craving for cold drinks and ice cream. This was very much marked. Aversion to vegetables. I think all kids have that, but this child has a typical aversion for all vegetables, milk, and spicy food. Perspiration is scanty. He's again, I could not fathom more into this thing because the mother tried to tell me, but then I came to conclusion amphithermal, but more towards hot. What I could take up during the interview when I asked other questions like bath, then his drinking habit, whether he likes cold milk or hot milk or cold tea or hot tea, something like that. So he was gravitating more towards hot, though I would take it as amphithermal at the moment. Stools are normal. He grinds his teeth occasionally and laughs in sleep. This is one thing which is peculiar in the physical generals. And he dreams of fairies. Okay, all good things. Fairies coming and giving him some presents, and he has gone to school. The fairy has come and given him first rank. He would narrate all these dreams to his mother in the daytime. So a very vivacious child, in fact. And the rubrics that I've taken from complete repertory. I've used only complete repertory. Mind, obstinate, headstrong, restlessness, nervousness, tendency, mischievous. One thing I've not written it down, but I would like to bring to your notice that this child has an elder sister. She's almost elder by 4 years to him, but he bullies the elder sister. He hits her, bites her, whenever she's not paying attention to him. So that is the type of relationship he has with his elder sister. Okay, not a very child who says 4 or 5 years, an elder sister or brother is there. Generally, the younger sibling may not be so overly what we call mischievous, But with her, he's that way, and he can be very. The mother was saying, "I feel very bad for my daughter because at times he keeps on pulling her hair. He will tear her clothes. He'll once he has gone to her room, and just a day before her birthday, he has cut her dress. This child has so mischievous, attention seeking for that matter. So mischievous, memory very active. He's a very what you call. He has a strong memory. He can. They are surprised. He was just a baby when he was 3 years old. A 3-year-old baby may not remember what has happened at the age of 5, but he can still relate. Mummy, we had went to that grandpa's place. Grandpa had bought this particular toy for me. I mean, he has a very strong and active memory. Even when he opens or breaks the toy she was saying, we know that he will know which part is of which toy. At a time, he'll open 2, 3 toys. Okay, and he'll try to find out how it works. So she says, that's very funny. She says, I find his memory so active or sharp that he knows what part is of what toy at the moment. So very clear in his perspective of when he destroys something, he knows what he's destroying actually. So anger, irritability, tendency to, I've taken that as a rubric again. Biting, because he has a typical habit of biting, especially sister and his mother when he's angry. Destructiveness, whatever new thing comes to mind, he has to break open and see it. Play, desire to be playful. And heat in general, I've taken. Yeah. And generalities convulsions, because he did have one episode of convulsions. Because this particular case was a bit intimidating to me, because this particular diagnosis of this case, first time ever I was seeing such type of case. Fortunately, like I told you, it was an emergency case with so many diseases playing to and fro, right? From convulsions. Then he has a gritting of teeth, which I have not mentioned. I'm so sorry, but in the past history, he also has a history of tapeworms. Okay, he was given medicine for that, and that's what his CT scan was done. Okay, the CT scan revealed that there was some cerebral dysfunction, and that's why he had got convulsion. So they had given him antihelminthics for a short while when he was admitted for the treatment of his malaria. So this is one thing. So there's so many things which were there in the disease picture itself. So after repertization, I'm not showing the repertization chart again. I was not able to put it actually. The following remedies were considered. These belladonna came as a first grade. Hyoscyamus, this is a complete repertory. Hyoscyamus as a say all these remedies were the first 5 remedies which were there on the repertory sheet after repertization. Belladonna, hyoscyamus, stramonium, veratrum alb, tarantula, and lachesis. Now, the interpretation, what I would like to understand is this child is a combination of choleric and sanguine. Like I told you in the beginning, you may not get a case entirely of one particular temperament. Predominantly, you may have a combination. So in this child, what I understand, this child is choleric and sanguine. He's choleric because he gets annoyed if things don't work his way. He hits, throws things in anger and strikes in anger. That is how a choleric person is. He's bold and does not fear of hurting himself. He's not afraid of elders, bullies his elder sister. He's destructive, breaks his toys or gadgets, and he expresses displeasure by imitating and teasing people around. So these are typical qualities, the weaknesses what we find of choleric in this child, choleric temperament in this child. And he's sanguine because the other part is he loves to talk and makes friends easily. He likes to travel, go out, very mischievous, and derives pleasure by imitating and teasing others around him. And this imitating and teasing in class also, suddenly he will get up and start clapping his hands so that all his friends start laughing. Means he wants to be the center of attraction. The teacher may get angry, and he's so charming. The mother says the teacher also like him very much, though he's very naughty. They say he's very naughty, but a very good. I mean, we miss him if he doesn't come to school. So that is the reputation that he has. Very restless, fond of watching comedy serials. See, sanguine people will never watch something which are melancholic, will not listen to songs which are melancholic. Okay, they will always want bright, happy, happening, or disco music all the time. So remedy analysis, like all these remedies have all these symptoms, but what I understand is, I think we can have more inputs from your side also. Bell child is basically plethoric, full of vigor, does everything with a lot of power, tears, bites, and strikes, likes to play rough games, and is fond of moving around. That is, moving around is something like exercise. Okay, so this child is exactly that. He'll not sit in one place. He wants to do something or the other. Hyacinthus child, on the other hand, the second remedy which came in the reporter sheet, tries to act funny by making foolish gestures, and is also disobedient and mischievous. This child is not foolish. He doesn't make gestures. He is definitely mischievous, but not disobedient to a great extent, because he likes to please people. He makes friends with even strangers, and he does uh, listen to his mother and do what she expects. Only if he's contradicted, then he goes into a bad mood. So Hyacinth and Beruna, hope you understood. So the difference, what we can see in this child, will come to a conclusion later on. So third child is Tarantula. They are basically restless, love to dance, are cunning and manipulative, something like what this child is at times. Lycasus loves to make mischief and is revengeful and a quarrelsome child. This child is not quarrelsome. He will make people laugh. If he gets bored, he'll move out of the sight. So, and Stramonian children are restless, destructive, often fearless. The point that I came struck to my mind is, as soon as the fever comes down, he's very back to his usual self. He again becomes very what you call motivated. He's jumping, laughing, playing as if nothing has happened to him. And when the fever is at 103, 104, and mind you, he has also got convulsions because of fever, and he's also been diagnosed with COX at a particular time, which the treatment was going on for almost 6 months, okay, until they came to me. So stramonium is, if you see the remedy is stramonium, now once we go into more details, we'll come to know, is basically choleric, sanguine, and nervous. In this child, choleric and sanguine personality has erupted a lot, and stramonium also has a fearlessness with the child portraits. Like there, some examples a mother had given, which was difficult to believe, that he has jumped nicely from the first floor and down, and fortunately nothing has happened to him. Okay, so this is a type of antics that a child has done at the age of 4 or 5 years, no caution at all. Okay, so this is how a stramonium person is. And the main thing, I identified this child and I wanted to give him stramonium after repertization. It came as a first grade too, that's a different thing. But basically, because of this fever, as soon as fever comes down, it's very clearly written in Materia Medica, even in NASH, the person comes back to his normal self in a very different manner. When you see the fever stage, it's very bad. They are very dull, morose, they're murmuring to themselves. But as soon as fever comes down, their usual self. Okay. So remedy selection follow-up, I've given stramonium. I just wanted to not particular this is a case, I just wanted to focus on the temperament aspect of it. So quickly I'll run through the follow-up. So stramonium 25th first 24, he was given 1 one dose, no fever. He came after 4 days, no fever since 4 days. Itching on legs had started, grinding of teeth was there. Okay, and lymphocytic analysis suggestive B cell. This I was in touch with the pediatrician, his pediatrician, who was also his mama, cousin mama, suggestive of B cell deficiency with hypoglobulinemia. They had also started immunoglobulin injections for him at before they came to me. So the pediatrician immediately stopped the immunoglobulin injections, and he told, you can continue with your homeopathic treatment because I don't have any role right now. And since he's doing well, you please continue with your treatment. So after just gave him SL and sent him back, because one dose was just given 4 days back. On 15th, he came for the next follow-up. And that time he had fever, cold, and body ache. The fever was again 103 to 104, but this time with cold and body ache. So I didn't think that the medicine had to be changed. I just gave.
Dr. Shahala,
Yes, sir.
sorry,
Yes.
29 4 24 no fever,
Sorry, sorry.
and again
20.
15 4 24
No, it
fever.
should be 5, sir. I'm so sorry. This
Okay,
particular case I've typed this
okay,
afternoon.
doesn't matter.
Uh,
No problem.
yes, yes. So good for pointing out. So I'll just do the correction.
Okay.
I hope the audience takes it. It is 15/05/24. And then
Right,
again 19/5/024.
right.
Okay, I'm so sorry.
No problem.
Okay, so no fever was there. Stramonium, he came on after 3 days, because generally what I told them, if of course we do for all the fever cases, we see them very early. So after 4 days when I saw him, he had no fever that particular time, and but he had cold and cough, but didn't want to give any medicine, because in general the patient was fine. He was active as usual. Like I told you, whenever he is not having fever, he is himself running like a monkey all around the clinic, jumping from this place to that place. So cold and cough, SL was given. And then after 2 months, until that, the patients were in touch, but we didn't have typical follow-up session for him. So he came, sorry. Yeah, in general, he's doing very well. weight gain is there from 16 to 19 kgs. And he's still on follow-up at the moment. I mean, I'll expect him again after 15 days, but he's doing well. So what I wanted to just present in this particular case is the patient was a combination of choleric, sanguine, and nervous, and stramonium covers all this thing. And that is how we can see our patients through temperaments too, to make our prescription more emphatic or more positive. No, we can, with more confidence, you can also understand, because mental generals are the core of any patient of ours. When we get the symptoms, and especially when we understand the temperament in the core region, see, we can see the disposition of the child, we can see his state when he's not well, and when he is totally in a so-called healthy state, okay, or apparently healthy state. So this one particular case, I just thought I should share with you. I hope
Did
it.
you consider tuberculinum?
Sir, I just thought maybe later we'll think about tuberculinum as an intercurrent, sir, because stramonium itself in 2 doses has given very beautiful results, sir. Because this child used to be an ibugesic and crocin so many several times. The his doctor, what you call relative, was so fed up, and he was also scared that I'm dosing the child with so much this thing. So maybe as an intercurrent, this child is still on follow-up. I'll be seeing again after 15 days.
Okay.
Because it's my wish that I present cases mainly on temperament in some other presentation in the future. So that maybe I'll take up this case again, sir. So I'll go back to our next temperament. So
Yes.
we are finished with sanguine, we are finished with choleric. Okay, both are very positive, very vivacious people, but with lot of difference. You know how sanguine person is self-centric, wants to have fun, enjoy all the time, only work, only play, sorry, no work. Whereas choleric is just the opposite, equally vivacious, equally talented, skillful, but he means business. Okay. So we'll go to the third temperament, melancholic, as the name suggests. Okay, and the statue is a very famous statue in Greece. Okay, a melancholic temperament basically is an introvert temperament. They're great thinkers, pessimist. Okay, you can say all the philosophers, the artists, the real serious artists, especially in the Victorian era, all these people, we can put them in melancholic temperament. So these are the basic keywords. Please remember: introvert, thinker, pessimist. Actually, opposite of the first two temperaments. So melancholic temperament are thinkers, like I told you. These are people of serious purpose. They are dedicated to order and organization. They appreciate beauty and intelligence. So I said basically all the artists come into this category of melancholic temperament, because they think a lot. They appreciate beauty and intelligence, and they have a certain way of organized way of working. Even if it's disorder, they are disorderly organized in a very disorderly way. Okay, so they're creative, very conscientious, fastidious, and thorough. So all these Leonardo da Vinci and all these people come in melancholic temperament. I was reading somewhere else, I think in ma'am's book, Panya Zumra, she has given a beautiful example of Da Vinci's paintings, and how this person can be very well put in melancholic temperament, because his personal life was all in shambles because of his melancholic temperament. He had a failed love affair, and how he was reacting to it, and how he came up with this beautiful painting, Mona Lisa, to date, which is a beautiful painting of all times. So basically, melancholic temperament people are creative, they're very conscientious, they're fastidious, and very thorough. So all men of genius are melancholic temperament: writers, artists, musicians, etc. Yeah, just to have a look. This picture is very depictive. I got it from the net, so I just thought to have a better understanding. So emotions, they're deep, very analytic people, serious and diligent. They don't take anything lightly. So very less a sense of humor in these people, no? I don't know how a sanguine and a melancholic people would stay in one room. You know, that type of people, serious and diligent, tend to be genius. They are very talented, creative. They want their own space. They appreciate beauty. They're sensitive to others. That's very important point. They are very self-sacrificing people. They say, if you have one melancholic friend, your life is done, because you can always turn your back to that person for all the support and help, and he'll always be there for you. So self-sacrificing. See, a sanguine temperament may come only when you're happy. A choleric temperament person will see whether he can derive some benefit from you, and if you are too much in a bad mood, he will give up, and because he has better work to do, feels you are depressed or dull, it is your problem. I can't help you more than this. I can only direct you towards a good counselor or something. But if you have a friend who is a melancholic temperament, these are people who will be always with you. They're very sensitive to people's needs. And in work, they're very schedule oriented, perfectionist, highly standardized people, and persistent, carefully, disciplined. They're very organized, visualize problems very clearly. They manifest and visible very clearly. They visualize the problem and try to help people even beforehand. Suppose, like I'll give you an example of my patient few days back. This I was just talking to her. It just came to my mind this afternoon. This person does have a melancholic temperament. She is a case of natrimute, but then शी हैज अ मेड शी सेज डॉक्टर हम मेड्स को इतना डांटते हैं और बोलते हैं कि ये ठीक से नहीं रखा ये मशीन क्यों ऑफ नहीं किया बट उनके घर पे तो मशीन्स होते नहीं how will she know to work poor thing she's trying her best so I teach my maid how to use the machines how to put off the geyser how to put up the she has an egg boiler she was saying so I mean they can be so sensitive if it was a sanguine temperament you would have just scolded if she was a sanguine temperament oh you don't know to this thing you spoiled my machine you don't know how to put it on that sort of deep understanding and having a sense of sensitivity towards other people is very marked in melancholic people. So they make creative solutions. Okay, if you cannot do the work like this, let me plan out, you do it like this. That is how they will help people. And finish, they also industrious like the choleric people. They finish what they have started, not because they mean business, because they feel somebody is dependent on me for this particular work. So they will see that the work is done and given to them. So they prefer diagrams, graphic and visual aids because basically they're creative people. They like to explain things in detail because they enjoy their work actually. Even if it's small work like making presentations, making some graphs, they will do it with full diligence and full concentration and creativity. And that is why they're successful in that type of work, the artistic type of work. But they're also pessimist. As a friend, they're careful in making friends. They can be friends to many people, but they'll have one or two people as friends only. Not they can't share their problems with everybody. They are away from attention. They are backbenchers, not backbenchers actually. They are backstage people. They will not come in the forefront, even though they are doing all the work. They will let the sanguine person or somebody else take the limelight, some other temperament, but they will be at the background, but they will see that the program is successful. So these are the melancholic people, capable of solving people's problem because they're concerned, they go into in depth of the problem and they're easily moved by tears, full with compassion. They're looking for real ideal mates, they just can't settle on for just people who are superficial, whether it is friends, mates, life partners. As a parent, they set very high standard for their kids idealistically. Okay, want everything done in a very right way. They always keep the house neat, clean. The stuff should be placed in a particular order so that not because they are festivities in a particular way, because they feel if I keep in that place, my father, who is an old person, if I keep in that place, it will be useful for him to go and find out. He will not be troubled that way. Not that I'm busy. If a sanguine person is there, a choleric person, I'm busy. And anyway, he has kept it in the wrong place. Let him come and pick up. Not that way. They will try to keep it in the right place so that the parent or the elderly person does not get affected by by their own what you call where they have placed the stuff. So willingness to sacrifice for others. They encourage intelligent talents. They are not jealous people. A choleric at a point of time, though they are great leaders and teamwork people, at times, if they feel their leadership is slipping by, they can put down people down and go ahead. Okay. Sanguine, though, is not bothered. Okay. You make me a leader today, I want to be the fun person. But melancholic is not that way. If they feel, oh, he is better than me, they will give this way to the person behind and say, please go ahead and do this work. So they are mellowed down leaders in a different way, more of sensitivity. The only thing of weakness of melancholic people is that they are inexpressive. They cannot express themselves very, what do you call, in a very broad manner. They are reserved. They find it difficult to form new friends and speak very little among strangers. In a party, if you go and see a melancholic person, you can identify him very clearly. He will not be the first person to come and say hello, not because he's arrogant, but he cannot do that. So once somebody comes and speaks to him, he will open up. The problem with these people is they have so much talent, they have so much artistry in them, but it's underutilized talent. The pride of the melancholic has a very peculiar side of it. They do not seek honor or recognition. In the contrary, don't want to appear in public, and they always backstage. So sometimes talent, when it has to be utilized, or when it has to be projected, so these people can be failures in that sense, in spite of being very good skilled workers or skilled artists and things like that. There's a pathological fastidiousness in a person, because he's vividly expressed and provoked by disorder justice. Something is happening wrong in the neighbor's house or the neighborhood. Forget about the neighbors or neighborhood also. Okay, neighbors, though, they'll be very concerned because they're very sensitive people. Even the far off neighborhood, they will go and they will fight it out. Okay, the cause of this exasperation or this desperation is often justifiable, but rarely to the degree felt. Other people may feel, "Itna zaruri kya tha? Why did we have to? Why did it go and fight with these people for such a small thing? At the most, kachra usne hi feka, and that person, it fell on his dress. Okay, they could have sorted out. But this person, no, it has been done. He will go and fight with the person who has thrown the kachra on the other person and try to sort out the matter. So it can be to that extent. So weaknesses of melancholic people are because they themselves are so sensitive, and they look after the in-depth feeling of their people around them. They're very unforgiving in nature. Once you hurt a melancholic person, once you hurt a melancholic friend, you have lost the friend for life. Okay, not like sanguine. Are no problem. मैं कल ऐसे बोला था, कोई बात नहीं. Today we are friends again. Not like that. So very unforgiving nature, lack of assertiveness. They can hardly forgive offenses. The first offense they ignore easily. Yeah? That is one very good point about them, because they feel first time galti kiya hai, maybe uska kuch he may be having some what you call reason to that, so it's okay. But renewed offenses, like how a staphysagria person suffers, no, penetrate deeply to soul, and he cannot forget them. He can may forgive them, but can never forget them. Strong aversion easily takes root in his heart against persons from whom he has suffered, or in whom he finds this or that fault. Okay, and this could be a very common story between the daughter-in-law and the mother-in-law. The mother-in-law is no more, but the daughter-in-law will still talk 25 years back. My mother-in-law did this to me, and I'm feeling so sad about it. I didn't deserve it. This is a very common theme we see. Of course, I'm just talking it in a jest, but this is how the melancholic people are. Time alone is vital for the reflective and introspective person. They are perfectionists, sometimes to the point of scrupulousness. Okay. They long for deep soulmates, yet when people around them, he finds mistrustful and disappointed, because they are so intense in the sensitivity or understanding of people. So they long for a soulmate, which is so difficult to find in this modern world. Okay. Others keep their distance, further entrenching him in solitary life. Because it's so sensitive, that can be quite uh, disgusting for the people around, because if somebody is so sensitive, you cannot relate with them so easily, because you always feel you'll hurt them. So most people keep a distance from this melancholic people, and that is why again they are having a very solitary life again. They tend to slowly initiate, be hypercritical and pessimist. Once committed, like I told you in the beginning, they are very unwaveringly loyal and selfless people. So this is the weakness of melancholic temperament. And the strengths are he's willing to make great sacrifice for his neighbor, I told you, and is strong and unshakable in the battle for ideals. They're good at decisions and have a strong sense of responsibility. The decision making is very good in them. They don't falter. They know if this is right, it has to be in this particular way. They adhere to the rules. That is the thing. Whereas a choleric person may not necessarily adhere to he may change the rules, bend the rules according to his need of the job to be done. But no, a melancholic person, yeah, if my job is not done, no problem, but rules are rules. Okay. So these are the way this choleric people tend. You may find many such people in our patients, people around us, wherever we are working, especially since we are related with patients more than people, but also relatives, friends, we find such people. So the melancholic is often a great benefactor to his fellow men, you can say, because they are good to people. He guides others to God. Most of this priests and I'm not talking about the modern day gurus. I'm talking about people who are really into preaching and other things. They are melancholic personality, and he guides others to God, is a good counselor in difficulties. They're very wise, trustworthy, and well-meaning superior. They're also trustworthy. They can keep your secrets very, very much till they go to their grave. So that is the strength of a melancholic person. That's why they're very good friends, I told you. No, if you backstab them also, they will not tell your secrets back to somebody else just because it's backstab. They will keep it to themselves. Though they will be hurt by this person, they may totally cut off the contact with that friend, but they will not reveal the secrets or the bad things about their friend who was their friend once upon a time. They have great sympathy with fellow men and keen desire to help them. So the rubrics that we take is after griefs we can take for the melancholic temperament. Conscientious about trifles, sentimental, fastidious, brooding, industrious. I try to differentiate the industrious of temperament in different temperaments. Industrious in choleric is one's job, it has to be done because I have to keep up my word and because I'm a leader, people are dependent on me. Okay, industrious in your sanguine temperament is only to grab attention. Okay, I'll do the work so that you understand that I've helped you. Okay, and so the other rubrics are company aversion to, mildness, sympathetic, hypochondriasis, suicidal tendencies. That is why Oram met. If you read again Kent, Oram met, what he says is this typical gentleman has everything in his life, you know. He has money, he has all the richness, and one fine day you hear that he's hung himself or shot himself dead. And this is basically because he's broken down at the level of the will. Something deep, he's not able to enjoy his present situations, you know, in spite of having everything in life. So that is how the suicidal tendencies are present in a melancholic person. They will not sanguine people will threaten you 100 times. Okay, and they may not commit suicide. Choleric may commit, but suicidal tendencies in are the most dangerous ones, and that is why in psychiatric cases when we find this temperament we have to be extra careful with our patients, you know. They one fine day you hear that they're gone, they've just committed suicide, they have hung themselves. So thoughts and thoughtful, this is the rubric. Remedies, like you must have guessed by now, natremure, ignatia, Oramet would indicate the melancholic temperament of our patients. There are many more remedies, these are just examples.
Shala, can we expedite?
Yes, sir. I'll go through only the
Yeah.
main keywords and this thing.
Yeah.
Phlegmatic temperament keywords are introvert, watcher, and they are basically pessimist people. Phlegmatic, very slow. Okay, something like this couch potato person who will just sit and watch and do nothing, and very pessimistic nature. They're extremely slow, space, and stubborn. This temperament goes through life doing as little as possible. They want to expend little less energy. At this point only, I can give the example of Calcarea Ka. They are just happy-go-lucky people. In their own skin, they are very comfortable as long as nobody troubles them. Graphitis is one such patient. That is the phlegmatic constitution. And only sleep can regenerate a phlegmatic person. So once they sleep and wake up, they are fresh and fine. Otherwise, nothing else helps them. They are the ones who are not ruffled by anything. Not that they're strong, they have a strong quality. It doesn't matter to them. Something good or bad is happening, let it happen. They don't cause trouble and they don't create troubles for this. So they don't have any enemies. They are in one corner just being watchers. Something is happening, a quarrel is taking place. I'll go and stand in one corner and watch it, but I will not intervene. So these are the phlegmatic people. So they're very much inclined to eat, drink, be lazy, and they neglect their duties. They have no ambition, and they do not. They are observer rather than a participant. Very indecisive. They tend to procrastinate a lot. Very difficult to motivate such people, especially if you have them as a staff or things like that. Very difficult to. They're not trainable people basically. He might give halfway to the project if he feels there's too much effort involved. I don't mind if I don't get a salary. I'm leaving the job and going. I had one such receptionist I remember. Okay, so the phlegmatic works, the strengths are they work slowly, perseveringly, but if his work does not require much thinking, he will continue the work. They are very good workers at the clerical level because they just have to follow orders, right? They don't have to think, they don't have to create something. So they are good clerks. They're not easily offended by people, failures, or sufferings. Everything, they're very blank people, you know, very dull people. Remain composed, thoughtful, deliberate, and have a cold, sober, and practical judgment that way. If I go and do that, I'll fall into trouble. So let me be away from it. That is how their practical judgment means. They have no intense passion. They do not demand anything of life. Nothing ruffles a feather. They're happy with how the life is going on as long as it is going on with their basic needs being fulfilled. They're not ambitious people at all. So rubrics are after mental work, dullness, sluggishness, confidence, want of childish. All these are there in our materia medica. Irresolute, indolent, aversion to work, mildness, timidity. They're deficient in ideas. They're not people who come up with great ideas. So they're only followers. Kalkira ka, Baraita ka, Pulsilla. all the time crying, also gaining attention. So these are the remedies which have predominantly a temperament, this a phlegmatic temperament. Yeah, now we come to the last temperament. So nervous temperament, basically, these are people are very excitable, apprehensive, studious, and they have bipolar moods. They're happy at one moment, suddenly sad at another moment. They get offended easily. They get agitated very easily. So the key words are they're basically introvert, anxious, pessimist. So persons with this type of temperament may be undisciplined and forgetful because of stress. Not that they do their work very well, and the last moment they forget what. For example, so today, like uh, Sir just told me, well, if your temperament is that, you can follow. So I think I come in the nervous temperament category, according to Sir. So this type of temperament, maybe they do their work very properly, but when the time comes, they are not able to project themselves. So they take a lot of undue stress. They lack confidence. They're always on the edge and hyper, bordering on depression. They're impatient and hurried. They're indecisive, hesitant, timid, and messy people because they are again anxious. Such people can never make up their minds whether I should buy this dress or that dress, this color will suit me better or not. Okay. And the decisions can be changed easily. They can be influenced easily for a simple matter. Some of that traits are haphazard, inconsistent, and very unpredictable. Tremendous anxiety, anticipatory anxiety, or a regular anxiety, which lowers down their potential. Though they are very capable people, but because of the anxiety, their potential is totally destroyed. They perform by their fears instead of their capabilities. We all need a little fear to perform well, but for them it is a little more than the regular people. So very pessimistic in their approach. They have very negative vibes. They turn extremely cautious towards any problems. Okay, if they have a small boil, they will think it's a tumor, it's a cancerous tumor. To that extent, a person can be excessively obsessed with health. Callie Urs is a very good example, especially obsessed with heart health, and seem to unnecessarily dwell on it. I will not take this case; some other time we'll take it. But I have a beautiful case of Callie Urs with this particular temperament. Not very good decision makers and can be swayed easily or can be influenced by authoritative people. So a good boss would be a choleric person, and a good worker would be your nervous temperament person, because he can be made to work with by putting fear. That's how the slavery would work in the initial days. Now, so cannot take any changes in life very easily. They are very routinist people. Any situation that will disturb them, they can't take it. Okay, unpredictable. They're not sure of themselves, so it's very difficult to assign work to them because we do not know when they will, out of anxiety, the whole work could just falter down. But strengths are they're very punctual with appointments. Lot and lot of people, urgentum nitricums, gelsemium, you find in our clinics because they come even half an hour early. We say the clinic is not open. No problem, no problem, doctor. There's a bench outside. I was waiting outside clinic. I wanted to be on time. So that's the type of anxiety that they represent. Always well prepared before a presentation. They cannot come and just start in this presentation without any preparation. Very alert while approaching any problem. If they are encouraged, they can become good speakers because they do their homework very well. So rubrics are anticipation, confidence, want of self, confusion of mind, starting, startle, hurry, impatient, hypochondriasis, fear, timidity, restlessness. All these particular rubrics are there in Kent's Materia Medica, but all together are put up in Complete Materia Medica. So I've taken Complete Materia Medica as a base again. I'm reminding you. Remedies like argentum nitricum, gelsemium, arsenicum stand for the nervous temperament. So as it is obvious, some rubrics overlap in more than one temperament. Thus, the projection of the symptom may be the same in different temperament types, but the reason behind it may vary. Okay, for example, the fastidiousness arsenic album and Nux vomica is entirely different. Okay, Nux vom person gets highly irritable, and that is the type of fastidiousness he has. If the thing is not, if something comes in his way, for example, a flower pot when he enters, the child has thrown it in the doorway, he will kick and go. Arsenic album also wants fastidiousness. He's a fastidious person. He'll remove and keep it back in the place if it is not done by anybody. So that is how the projectional symptom is same, but the temperament types make the reactions different. Okay. So we realize sanguine restlessness stems from enthusiasm to more. They want to be in the picture, limelight. Nervous restlessness stems from lack of confidence. Because they're having lack of confidence, they get what we call they realize that they are restless, before any presentation, or you have what you call, most of them have examination diarrheas, examination funk, which is again related to your nervous temperament. So I will not go into the details. A choleric industriousness emanates from getting work done, whereas a melancholic industriousness is self-imposed. Because I've given a word, I have to do it. Whereas choleric, I'm the leader, I need the work to be done, you get it done. In a melancholic patient, being an introvert would mean being reserved. In phlegmatic, it is out of timidity. So if you have a common situation and 10 persons around, everybody's reactions and expressions would differ. And that is why we call it in homeopathy as individualization. So in short, sanguine is the one who talks. Choleric is the one who is more action oriented. Melancholic is the one who ponders. Phlegmatic is the one who just watches the scene. Typical Calcarea ka. Nervous is the one who, while looking at the scene, gets agitated and tense. So the advantages of using temperaments are many. We can use it as a filter to arrive at the final prescription after the repertoire list is ready. Because homeopathy is so vast and so versatile science, we cannot stick on to one method for every patient. We cannot standardize the method of prescription. So temperament is one such thing which we can easily identify and help our patients better to filter out a remedy, isn't it? There are so many schools these days. So more, it's not a confusing thing actually. We should only know when to use what. Of course, a lifetime is less to work on homeopathic prescriptions. That's a different thing. So by incorporating temperaments in your case taking, you can understand the patient better. Okay, not only patients, I think in our personal relationships also, if we understand this part of temperament, we can have better relationships. If you're empathic, if you're the melancholic type, or if you're the choleric type, okay, for that matter. And thus you vibe at the wavelength and make him open up to you. For patient, this becomes very important for me as a physician, because I have to be unprejudiced. So if I look at it temperamentally, I can do more good to my patient and not come with a remedy which I prescribe on the facade or the personality the patient is projecting to me. So in short, extroverts, sanguine is an extrovert, talker, optimist. Choleric also an extrovert, doer, but he's not really talking, but he's an optimist. Melancholic is an introvert, thinker, pessimist. And phlegmatic, as you know, they are also introvert, they're watchers, they're pessimist. Nervous, introvert, anxious, pessimist. So we have two optimists, sanguine and choleric, and the rest three are pessimist people. Okay, but each one has a different reaction. Talker, doer, thinker, watcher, anxious. I hope this small table helps us to understand. So advantages, again, I'm talking about the materia medica easy to grasp, as the study helps us to differentiate one remedy from the others effortlessly. The understanding, especially in, if you go through Farrington, he has given a beautiful picture in his preface. If you read, he says when a sulfur patient walks into a clinic, you know it's a sulfur patient not because you're prejudiced, because you understand the temperament of the sulfur patient in such a way, it is ingrained in your mind. As a physician, you will prescribe sulfur and that works out as a right remedy. So you avoid becoming myopic in your practice if you understand temperaments. It's not that the remedy is pulsatilla because she's crying. Okay, the crying can be a symptom in all the temperaments. You need to identify what temperament is so that you can prescribe this pulsatilla, calcarea calm, or staph aureus for that matter. So this temperament study usually helps us to widen the horizons of letting you consider many potential remedies, so which has been difficult to entertain in the thought process in the past. So if I have some difficulties, well, I can just take the support of temperament and understand my patient, because many times in a busy practice, to sit and talk for hours with the patient is difficult. But I think if we grasp the basics of temperaments, the characteristics of each temperament, it will help our practice to be a little more fruitful. This is the most interesting slide and question. So what temperament should a homeopath have? Anyway, this is the last thing. Can anybody contribute?
You only said first two are better.
No, sir. Which temperament will a best homeopath make? Yeah, you feel the first two are better? Any other thing in the chat box, sir?
Sanguine, it is mentioned.
Sanguine. Okay, but sanguine can be so unpredictable. Imagine if a homeopath is sanguine temperament, the moment the remedy fails, he's going to say, okay, you go to other doctor. You're left nowhere. Yes, a very good person.
Melancholic, phlegmatic,
Yeah, if the
melancholic.
doctor comes to your party, it is fine. I mean, a sanguine doctor
No,
coming to a party will be fine. But consulting a
many people
homeopath,
are writing melancholic.
many people are writing melancholic. Okay. But even that, see, oh, you were never going to all right. First of all, he only is depressed by his illness, you know. A small boil, he considers tumor. So imagine if a doctor starts thinking so deeply, because as a physician,
Dr.
yes,
Shahala, you are a philosophy teacher.
yes, sir.
You would appreciate that Hahnemann himself said he is an esoteric man.
Yes,
So he did not want any miasm to be attributed to him. So if
yes,
you
sir.
ask, everybody would say, I should not have any temperament.
No, but Hahnemann is as the progenitor of our science, definitely a great person. But in many ways, we would not like to follow Hahnemann, sir.
Of course, of
At least his
course.
temperament.
And one compliment to you in the
Yes, sir.
chat box. You are like Rajdhani Express, and that person is like a passenger.
Well, I didn't get the passenger. Who is the passenger?
The person who wrote in the chat box,
Yes.
he is like a passenger.
Okay. And I'm the Rajdhani Express. I'm so sorry because I was, uh, once I started putting up the slide, I realized this topic really needs 2 to 3 sessions
Of
to
course.
make a thing.
One gentleman wrote also that they want to hear from you about temperaments quite often. One more question actually is left there.
Yes, sir.
This question, if but you continue,
Yes.
you got a
So I
lot of
just wanted some
answers.
answers. So melancholic we got, sanguine we got, and you say soric, which is more towards sanguine.
No, no,
So
no. And many people have written even melancholic, sanguine,
I give the
and
reason. I don't. I we
choleric also two answers
But
for
choleric,
choleric.
if they can be too destructive, malicious, okay, you take this remedy and it should work like this, is so difficult for the patient, no, sir.
Varies from person to person. You are asking a good homeopath, best homeopath.
Not best home, okay, best homeopath. We all should aspire to be, we are good homeopaths, but we want to be best and the bestest in the coming years, isn't it? All
Then
of us.
I think they got exhausted, so they want answer from you.
Okay. It's very simple, actually. Again, it's a holistic thing. So the homeopath is expected to be phlegmatic in receiving the case, slow, steady, observe very well. Okay? It
Actually,
should be,
here I should add one point. Dr.
huh,
Rajan Shankaran, in
yes.
one of our SSMS, told that homeopath should be like an idiot. He
Okay.
should not show any intelligence when he is talking, taking the case.
Taking case. I like the word more than taking, receiving the case, which is put up by MLW school, because receiving is something more than just taking. It's understanding and going to the extent that a
Okay.
phlegmatic person does very well. Sanguine in his approach to the patient. Be positive. No, you don't have to be. The more the patient walks into this thing, something like we always revere Praveen sir, you know, any presentation he brings a life. In fact, when I was thinking how I'm going to present it, because of some personal reasons, I was not able to make all the slides. And then I said, sir is there, he'll take care of it. I mean, that is the sanguinity that this particular teacher of arts presents, you know. So we have to be sanguine as homeopaths towards a patient, because the patient who walk in will definitely not come with a happy face all the time. Not never they come. 98% of the times, poor thing, they're suffering, so they're coming to you. So naturally, when you approach the patient, you should be sanguine, melancholic in analyzing it. Think, think, think. That is a very important aspect. I think that Hahnemann was doing. Okay. Choleric in the final prescription. Now, so many remedies have come in the what you call complete repertory. What do? I should be firm with my final prescription. So, and at no stage, a homeopath should be nervous.
Hmm.
So, ending it with a
Fantastic.
beautiful, yes.
Fantastic.
So, so all this bibliography I've not taken
Good,
from the
good,
book.
good, good, good.
So, okay. So thank you.
Really, we should thank you, Shahala, for your fantastic presentation
Thank you, sir.
and the great
I'm sorry for
elucidation
the Rajdhani
about.
Express type of presentation, but in future, hopefully,
No, no,
we
no.
give more
It
justice to
is
this
no.
topic.
It is in 1.5 hours. You have given the gist of such a topic, which Parinaz wrote a whole book.
Yes.
So you can understand. And H.A. Roberts, of course, writes
And thanks
one.
to Parina's ma'am also, because I had
Yeah,
the honor and I have the gratitude of presenting temperaments in front of her, in
good,
what you
good,
call
good, good,
in
good.
Bangalore. And since then,
But
this has become replicated.
here, in fact, H.A. Roberts writes a word of caution. He says,
Yes.
if you depend on temperament in the prescription completely, it is like depending on a keynote.
Right.
They
No, that
will
is,
only
yes.
they will not be the whole sum.
Maybe he
So
also tries.
that is a word of caution to everybody.
Yeah.
And this is one way, as you rightly said, like one method, one approach, one way, which helps you to finalize the prescription.
Yeah. And once
Will
we
tell
should
you
consider the
ultimately
temperament and personality.
it is the expression of patient in the form of symptoms and signs.
Right.
That they will guide you to the selection of a right remedy.
Right, sir.
So these are all the helpful things. So it's a very fantastic presentation. And when
Thank
I
you.
read all that, there is only one question for you.
Mhm.
Everything is only praising you. So I'm not jealous that I don't read those praises about you, but
Right.
as we don't have time, so I'll ask the question which was asked.
Yeah.
Where do you see the rubric fearlessness under stramonium?
Fearlessness is there is a rubric, no? Fearlessness when when he becomes all right. That is the basic rubric which made me give that remedy.
Okay,
Because
when
he
he is
looked like
all
a
right,
belladonna patient initially, he because of the convulsions and because of the type of acute sudden onset. Belladonna is very sudden. This particular disease is very sudden in onset. It lasts for 1 week to 21 days max. But it can bring convulsions. It can. That's why we had to do the enzyme test also to see. I mean, I didn't do it. The pediatrician, of course, did it, and he explained to me why it was done. It was learning for me also. In this particular case is the first case I've handled of this particular disorder. He said, "Let us do it so that we know the intensity of the damage or injury it's done." So belladonna was coming as a first grade when I thought of it. But when I think temperamentally, this one rubric is there in a repertory in a materia medica. In fact, you can go through even Kent's what you call.
That's good. So
Repertory
refer
and
to
mathematical.
material America, you
Yes,
will get the answer, right?
yes, yes.
Very good. That is final court of appeal. So thank you very much, Dr.
Thank you, sir.
Shahala and
Thank
everyone.
you. Thank
Before
you,
we
everyone.
conclude, I have three important announcements for you people. One, please download HJIF IJH, which is free till now. Probably in future we will go for some meager subscription. Number two, there will be a webinar on 6th November as commemorating the death anniversary of our beloved Dr. Vishpala. Number three, on January 19th, 2025 in Bombay, we will have a physical conference, SSMS. So I request all the audience and please also inform your friends so that they can book in advance to come to Bombay on 19th January 2025 for a blast of knowledge, and you will have the presentations from the editorial board of our in IJH. So thank you and good night. Thanks Shala once again, and
Thank you,
thanks to
everybody.
all
Thank you
our
for the patient
IJH
hearing. Thanks a
and
lot.
all the friends.
Hope
Thank
to
you
see
very
you soon in
much.
January. Yes. Thank you, sir.
Thank you.